My name is Dr. Sudipto De, and I'm a robotic cancer surgeon based in Metro Hospitals, Delhi NCR. In this series, I'll be asking and answering the most frequently asked questions by our patients regarding different cancers. I'll be timestamping the answers in the description below. If you have any other queries, do let me know in the comments below and I'll be sure to answer them. Hello, friends. As this is Urinary Bladder Cancer Awareness Month, I'm going to be answering a few frequently asked questions about urinary bladder cancer. Now, the first question obviously is going to be, what exactly is the urinary bladder? It is actually an organ which stores the urine which comes from the kidney and helps it release at certain points during the day. So, the urge to urinate that you feel is the bladder filling up and then asking you to urinate. Now, how does cancer in this organ present as, or what are the signs and symptoms of this cancer? The signs and symptoms of this cancer basically are to do with urination in itself. There can be bleeding while passing urine, which can lead to discoloration of the urine, or there can be presence of clots. Along with this, there can be pain which can be caused during urination. Now, this pain can also extend to the whole of the lower pelvis or the lower abdomen. Uh, After this, the biggest thing is how to diagnose urinary bladder cancer. So, urinary bladder cancer is usually diagnosed by either doing a test on the urine to find out the presence of cancer cells, and a cystoscopy, which is an endoscopy of the urinary bladder to see how the tumor is, how many tumors are there, and what is the extent of the tumor that is present. Along with this, we also do certain investigations to find the extent of the tumor, which can be either a CT scan or an MRI, or we can do a PET CT, which can help us, give us the the whole body's image can be done in a single PET CT. Following this, understanding the staging and the survival of urinary bladder cancer. Now, when it is limited to the urinary bladder, it is usually stage 1 or 2. When it is outside into the surrounding organs, it can become a stage 3 or stage 4. Now, urinary bladder cancer usually is of two types, which is usually known as non-muscle invasive, where it has not invaded or gone through the muscle of the urinary bladder, and muscle invasive, where it has actually gone through the muscle. The treatments for these two, differ a bit, but at the end of the day, it is the muscle invasive, which is much more difficult to treat and has a higher recurrence chance. Coming to survival, survival in early cases or even carcinoma in situ is approximately 97% in 5-year survival. In stage 1 and 2 in the limited patients, it is easily goes up to 70 to 80%. When it has spread outside into the organs, it comes down to 50 to 70%. Now let's talk about the treatment for urinary bladder cancer. Now, as I said earlier, that urinary bladder cancer is divided into two major types. This is not the histology, where it can be transitional cell carcinoma or adenocarcinoma or squamous cell carcinoma, but I'm talking about how much it has spread through the muscle layers. So you've got two different types. You've got the non-muscle invasive and you've got the muscle invasive, which invades through the muscle. In non-muscle invasive, we usually tend to do cystoscopic removal of the tumors. Along with that, there is installation of chemotherapy inside the urinary bladder. Now, this chemotherapy can usually be chemotherapeutic drugs or even something, a vaccine like BCG, which can help eradicate cancers and slow down their growth, which can be in the coming years. In the muscle invasive one, we have to take into account more radical types of treatment. Here, the treatment is divided into two different parts, where you've got either the preservation of the bladder or you go in for removal of the bladder. In bladder preservation, we usually tend to do a trimodality treatment where there is cystoscopic removal of all the tumors that are visible, followed by chemoradiation. In the radical path, we usually tend to give neoadjuvant chemotherapy followed by radical excision of the urinary bladder. Now, a lot of patients ask that if my urinary bladder is removed, how am I going to urinate? and how my life is going to be. Now in this, there is going to be a certain problem associated with that, where the tubes coming down from your kidneys, the ureters, are actually put or transposed or joined into a piece of the intestine which can be taken outside. Along with this, there are some cancers in which you can actually reconstruct the bladder with the help of a part of the intestine. The complications associated with radical cystectomy as a surgery is known, can be of many different types. As it is a major surgery, all the complications which are associated with that can happen. You can have cardiac complications, you can also have complications associated with laying in the bed for too much, that is known as DVT, or you can have pneumonia, or the big cut can also cause a lot of pain. Uh, the complications which are very specific to the surgery itself are, firstly, obviously, there's presence of anastomotic leakage, where there is leak between the joint that we create between the ureters and the intestine. And there can also be infection which can be present in the kidneys. This infection actually tracks down from the intestine and then goes upwards, thus. So the next question a lot of our patients ask us is, how long is the recovery after the treatment of this surgery going to be? Now, if we are going in for a radical cystectomy, which is usually going to be after 4 to 6 cycles of chemotherapy, after that, once the surgery is planned, we will be assessing you for cardiac and for pulmonary fitness, and then be planning the surgery. If the surgery is done in an open way, usually food is started about the fifth or the fourth day after the surgery. You are asked to move up and around by the second or the third day after the surgery. And your stay in the hospital will be approximately about 7 days. Coming back to regular work, it will take you about 2 to 3 weeks for your whole body to recover, and about 6 weeks for your body to become healthy again, where you can do all your outside work also. Now, there is, the minimal access strategy of doing the surgery with. So, either a laparoscopic surgery or a robotic surgery will help you in that. This actually gives better recovery in case of both the minimal access surgeries. The incisions are reduced in size, obviously, and there is lesser blood loss. With this, there is going to be, the recovery is going to be much more faster. You'll be up and about quite early, and you will be also be able to come in and do your work however you want to by the second or the third week. Robotic surgery is a new path-breaking journey which does allow you to recover even faster and have better control over your whole complications. This does help us recover the patient faster, get them out of the bed early, give them faster return to normal life, and also reduce the complications, by the way. If we compare open and robotic surgery, recent studies have shown that both of them have similar oncological outcomes. Thus, do you ask for your doctor to offer you a chance at minimal access or robotic surgery? If you have made it this far, do like this video, subscribe to the channel, and share this video with any cancer patient that you might know. Again, let us know in the comments how you're liking these videos, and this gives us the motivation to kind of put out more content like this.